Onc Live Insights is a video editorial program produced by Onc Live.
It is very important to have an in-depth discussion with your patients and their families regarding the value of genetic testing, so cancer genetics testing. Because as you know, the world today the treatment is evolving into a more personalized, precision type of medicine. And most patients actually do understand and have heard the importance and the value of personalizing or applying precision medicine to medical care, but cancer care more specifically. So I think it's very important to establish that relationship with the patients so they actually see you as a physician who is knowledgeable about the subject, who's knowledgeable about how to treat these types of cancer, that it's very important to actually discuss with the patients the value of these types of testing. So there are different ways to introduce the subject. There could be part of the discussion, initial discussion about treatment. It could be a follow-up discussion after you establish, especially if you think that this wouldn't be the right time to introduce the discussion because it's not going to affect the type of treatment. I prefer to start this discussion earlier on, even though I may not use it for selection of treatment. But when you talk to the patient, it's very important to have the patients understand that there are a number of treatment options for them. So they need to feel comfortable with the idea that you essentially have plan A to Z already figured out. And part of that planning is introducing the concept of selecting certain therapies, whether now or later on, based on the genetics of the cancer, the genetics of the tumor. This is another thing that's very important to keep in mind. When you bring the word genetics, the first thing the patients would think about is their own genetics. Well, of course, everyone gets concerned. If I have cancer, am I going to have this transmitted to my children, to my grandchildren? So it's very important to make a very clear distinction between your genetics and the genetics of the cancer and what that means. And so when you introduce that discussion, very clearly say, I'm going to look at the genetics of the cancer cells, not your genetics. And if you believe that there's a genetic risk factor, certainly that's a different discussion. And then the way you would describe it for cancer cells is, mutations are drivers of aggression, drivers of why the cancer spreads, drivers of why this cancer grows in these terms. And if we can find one of those drivers, and we have an agent, a drug that eventually could attack that mutation and shut down its effect, then you certainly shut down the growth and the spread of the cancer. And in these terms, you bring the understanding of why these mutation or driving mutations are important to find in your testing and how you can match them to specific drugs available to you. In that continuum of care, and introducing various therapies across multiple lines, this starts making more and more sense to patients while you're doing this.
There are a lot of complex subjects that you have to teach your patients about, and the newest of those is mutations. There are a bunch of different analogies, and I think every doc develops their own. I like the one where somebody's gone in and messed with the fuse box. The wires are all right, but somebody's got the on switch when it's supposed to be off, that kind of thing. We talk about the etiology of cancer as mutations and how those mutations come about. So for the most part, patients have a basic understanding of that. But if you pull it out and make it some sort of real-world fuse box kind of blueprints messed up kind of analogy, they get that much better. Where it gets tricky is they start keeping score themselves, and the terminology is very tricky. RAS mutations, microsatellite instability versus stability. And even docs don't have a clear understanding of what all these tests mean. So I could imagine if you're not certain as a doc that you're only going to transmit more confusion as you try to describe that. So first, most importantly, make sure you know what the answer is. Develop a cute little analogy. You can use it every time. Don't worry, they won't hear it twice because it's two different patients. And use that so your patients have a good grasp of where their mutations sit.